good fit for public sector and union employers. If you think about healthcare costs and how much they go up, right? They go up 4 or 5% every year, even before the most recent inflation. And if you think about, somebody who's making $30,000 a year, you know how much the employer has to pay for healthcare on average? It's $12,000 a year per employee. No wonder there isn't any room to increase wages. The dramatic increase in healthcare costs is really eating into anything the employer could even do to increase wages. It all goes into healthcare. And this problem is particularly acute for public sector and for union employers, because oftentimes it's a fixed pot. There's so much money to go around. You want to give as much as you possibly can to wages, but then you have the healthcare bill going up and up and up. It's a real crisis. And that's the reason why public sector and union employers are increasingly turning to Carrum Health, because we have found a way to bring those healthcare costs down. To take those hundreds and hundreds of dollars you would have spent on healthcare, give them back to you so you can give them to your employees as wage increases. And these days, of course, we're not just worried about healthcare eating into wage increases. We're also seeing, pension funds really struggling, right? The market isn't doing that well, which means pension funds are down. Employers, especially public sector and union employers, have to put more money into these pension funds. And so what happens is it has to come from somewhere. But where's it going to come from, right? That's another example of where a solution like Carrum Health can help, because we can take it out of the healthcare costs. So instead of giving more and more money to hospitals, you can put it into the pension fund for your employees, or you can put it into wage increases for your employees, which everybody needs right now.